So good afternoon, ma'am. Good afternoon, sir. So my name is Anne Curti Blandres, level 2 nursing student from Notre Dame of Marbella University. So today I'm going to perform the antepartal assessment. In doing the antepartal assessment, it includes the three procedures. First is the measurement of the fundal height. Next is the Lupol's maneuver, and lastly is the measurement of the fetal heart sound. So I'm going to identify each of them. First, what is measurement of fundal height? So at about 12 to 14 weeks of pregnancy, the uterus becomes palpable as per glandular sphere over the symphysis pubis. It reaches the umbilicus at 20 to 22 weeks and xiphoid process at 36 weeks. And then often returns about 4 cm below the xiphoid process of the mother, or it is what we call the lightening at 40 weeks. If a woman is past 12 weeks of pregnancy, palpate the fundus height, starting from the symphysis pubis until into the upper or the superior aspect of the uterus fundus. And the next is the Lupol's maneuver. So when you say Lupol's maneuver, it is a systematic method of observation and palpation to determine the presentation and position of the fetus. And the next is the measurement of the fetal heart sound. Ang fetal heartbeat, it ranges from 120 to 160 beats per minute throughout the pregnancy. So fetal heart sounds can be heard and counted as early as 10 to 11 weeks of pregnancy by the use of an ultrasonic Doppler technique. So first, we are going to do the measurement of the fundal height. But before that, we are going to prepare all the needed materials to avoid delay or so that we can save time and effort. So first, we're going to use the tape measure, the stethoscope, the wet and the dry cotton balls. So first, we're going to introduce our name to the client, and then we're going to identify the right client so that we can build rapport, and then we can do the right procedure to the right patient. So good afternoon, ma'am. My name is Anne Curti Blandres, your nurse for today. So may I ask your name po, ma'am? So assuming that it is the right patient, and then after that we're going to explain the procedure so that it reduces anxiety and it enhances cooperation of the patient. And then next, we are going to instruct the patient to void or to urinate because or to empty the bladder, because it promotes comfort and allows for more and productive palpation, because fetal contour will not be obscured by a distended bladder. So ma'am, gusto mo ba mangihi, ma'am? Kay para duro-diritso ng aton nga procedure kag mas ma-assess ta insakto ang imong abdomen kag ang imong fetus. So assuming that the mother will already urinate, and then after that and then next we are going to instruct the patient to bend her feet slightly flexed for better visualization. So ma'am, pwede mo ma-flex ang imong tiil, ma'am, para better kag mas madali yung ating pag-assess, ma'am. Assuming that the patient have already flexed and she agreed to flex her feet. And then after that, we are going to drape the patient, exposing the abdomen. So ma'am, we are going to to expose your abdomen, ma'am. Hindi siya masakit, ma'am, pero siya, ma'am, it will be slightly uncomfortable. But first, we are going to provide privacy. We're going to close the door, the window. Okay. Then after that, we are going to drape the patient until into the symphysis pubis, and then the other one into the upper aspect of the uterus. And then, assuming that we have already washes our hands or sanitized it to avoid the spread of microorganisms. So we're going to get our tape measure, and then we're going to measure the fundal height of the mother. So we're going to place the zero in the upper part of the symphysis pubis until the superior aspect of the uterus fundus. So it is measured as 24 or 27 centimeters. So after that, but always tell the mother if you are going to put the tape measure to avoid discomfort to the mother. And then it is measured as 27 centimeters. Then record the data. So thank you po, ma'am.